Heart surgery saves thousands of lives each year, but it's often invasive and may involve scarring and a lengthy recovery. Until now. Today, many patients are benefiting from an advanced technique in which surgeons operate through one tiny incision.
Driving a truck. That's how Burl McClellan gets around when he's not working. It's also how he makes a living.
The truck driving job is very physical. We're lifting up heavy product all day long. It's heavy work, unloading, loading, dealing with product.
Burl knows his job as a truck driver is physically demanding. That's one of the reasons that he gets yearly checkups. But his last exam caught him off guard. Burl was told he had a heart murmur that would require open heart surgery.
When I was told about the surgery, I was very frightened.
I was extremely worried when I found out he was going to have surgery. I mean, anything that has to do with the heart, the automatic response was, oh my God, this person could potentially die. So I was very worried.
He was referred to heart surgeon Dr. Junaid Khan at Alta Bates Summit Medical Center in Oakland. Fortunately for Burl, it's one of the few hospitals in the country performing a new, minimally invasive heart procedure called port access valve surgery.
He had a leakage in one of his valves, the mitral valve, which is one of the trapdoors that's inside the heart. Blood is only supposed to go one direction, but in him, the blood was going in the wrong direction.
Burl's condition is called mitral valve regurgitation. Mild cases cause few problems, but Burl's condition was more serious.
If this was allowed to continue, he would go into heart failure.
A couple of years ago, before port access, Burl's surgery would have been done through a large incision in his chest bone. Instead, port access uses 3 small incisions.
The nicest thing about this procedure is we've been able to get patients back to their normal quality of life faster. They're able to go home sooner. They're able to do the things that they want to do.
The blood goes through the mitral valve into the left ventricle.
Using state-of-the-art instruments, including ultrasound and cameras, Dr. Khan and a specialized surgical team operated to correct Burl's heart condition.
The way port access surgery is done is there's really 2 components. One is we have to put the patient on the heart-lung machine.
The surgeons make a small incision in the groin and use ultrasound to guide specialized tubing to the heart. Another small incision is made in the neck, where more tubes are threaded into the heart through blood vessels. The tubes deliver medication to safely stop and protect the heart.
The second part is actually working on the heart. For that, we make a small incision under the right breast.
Using this opening, or port, with the help of small tube-shaped cameras, the surgeon can reach the diseased valve and repair or replace it.
The recuperation time, when everything goes well, is really quite fantastic. We've had a number of people who've gone home in 48 hours, which was unheard of after the old-fashioned operation.
The part that I found most fascinating was how quickly it took to heal, the recovery time. I was shocked.
Burl's scar is just below his breast, and he says it's hardly noticeable.
Well, Burl's recovery time was very fast. I think probably within the first 3 weeks he was able to get up and move around pretty freely.
Now Burl is back to work and back with his family, doing the things that he enjoys.
I'm really glad that they gave me the option for it, because it gave me the opportunity to get right back to work and to get on with my life a lot quicker than normal surgery through the front. I feel wonderful. Feel great.
And Burl is back at work and feeling